Hello everyone, this video we are going to see about the condition clubfoot.
I am Dr. Celeste Mary, Vice Principal in Administration at Tripplum College of Nursing.
Objectives: by the end of the session, learners will be able to define the term clubfoot, able to list the causes of clubfoot, classify the types of clubfoot condition and explain the treatment modalities, able to describe the nursing management of the condition. Moving on to the introduction about the topic, it is also called as Glick-Smith syndrome, or otherwise it is termed as congenital talipes equinovarus, the abbreviation of the term CTEV. It is a common birth defect occurring in about 1 in every 1000 live births. It is present at birth and affects the foot or an ankle. Approximately 50% of cases of clubfoot are bilateral, and this occurs more common in male child than in the female by the ratio of 2:1, and the main cause of this condition is as a result of arrested or anomalous development in the uterus. Definition: clubfoot describes the range of foot abnormalities usually present at birth in which the baby's foot is twisted out of shape or position. Moving on to the causes of this condition. First is idiopathic. It means the causes is unknown, family history, and maybe due to abnormal position and restricted movements in the uterus, and oligohydramnios. Next, we can move on to the classification of the clubfoot. There are various types. That is, first one is Talipes varus, Talipes valgus, Talipes equinovarus, Talipes calcaneovalgus, Talipes equinovalgus, and Talipes calcaneovarus. So, Talipes represents the ankle or the foot. So, we can see the types in detail in next slide. Next, we can see about the meaning of the terms. First is Talipes varus. Varus represents the foot is rotated outward so that the walking is done on the outside of the sole. Moving on to the Talipes valgus, here valgus represents the foot is rotated inward so that the walking is done on the inner side of the sole. Now, coming to Talipes equinovarus, it is also a common foot abnormality. The foot is points downward and inward. Moving on to Talipes calcaneovalgus, it is a combination of Talipes calcaneus, Talipes valgus, and it is characterized by plantar flexion, eversion, and abducted foot. Coming to Talipes equinovalgus, it is also a malfunction of the foot, and here the heel is elevated like a horse hoof and the heel is turned outward. Coming to Talipes calcaneovarus, it is characterized by dorsiflexion and inversion and adducted foot, that is combination of Talipes calcaneus and Talipes varus. Next, we can see about diagnostic evaluation. We can rule out through antenatal ultrasound scan, and after birth it can be detected by means of looking at the shape and position of the foot, and also through X-ray. Moving on to the treatment, it consists of 3 stages: correct the deformity, maintenance of correction until normal muscle balance is developed, follow-up observation to detect reoccurrence. Moving on to the first stage of treatment, correct the deformity. Here there are 3 methods of treatment: stretching and casting, stretching and taping, and use of Dennis-Brown splint. First method is stretching and casting, that is called as Fondesi method. Here manipulating the foot into correct position by placing a cast to maintain that position. Repositioning and recasting occurs every week for several weeks. Second method is stretching and taping, that is called as French method. It involves daily manipulation of the foot by adhesive tape to maintain the correct position. And third one is the use of Dennis-Brown splint. By the use of splint, the foot position is maintained. Next, we can see about the second stage of treatment, that is maintenance of the correction by special clubfoot shoes and by observation. Third one is surgical correction. It means for releasing the tight ligaments or to lengthen the tendon. And about nursing management, first is assessment. We have to assess the shape and size of the food, and next is manipulation of the food by means of casting or maybe the French method or use of Dennis Brownie split, or care of the infant, the child by cast method, and parents should be taught to cleaning the breast, skin care, bathing and cleaning the napkin of the child, and about the feeding and positioning the child, and about follow-up care. Thank you.